the committee was set up in order to discuss the provision in Gibraltar of mental health services for the young, and see what we were doing right, what we could do better, where the gaps were, how we could improve coordination from the different elements, and see what we needed to do to take this forward. I set it up as Minister for Health, now moving to education because it's very relevant to education and discussion with my successor, my colleague Neil Costa. We agreed that I would continue to lead this. I have a background in mental health from the last 5 years, and he will also be involved, and obviously the social services side and so on come very well into it. So that is essentially it. At a future stage, we will engage with NGOs who work in the mental health area, but at the moment we're looking at this. We'll be meeting shortly. We haven't met so far this year, in order to compile all the different bits of information that have come from the different departments and see how we take this forward.
In terms of public awareness, this isn't one of the government's better known committees. Is there a particular reason for that? Is there some sensitivity to it at all?
Not at all. There is no sensitivity. Mental health is a health condition, and we all have health conditions, and we all have mental health conditions affecting us in our lives. A lot goes on behind the scenes that we may not particularly give publicity to. So there are a lot of other things that are happening that may not be in the public eye. Just because you don't hear about it doesn't mean that the government isn't working on it. So no sensitivity at all. I'm very happy for people to be aware. And there will come a stage and we will ask people to send in their own views and so on. So it's a committee that, as I say, has been working for probably about a year, and is now about to come up with some tangible recommendations.
Well, we heard an NGO make references earlier this week publicly about the lack of care and provision for young people with mental health issues. Is this something that the committee hopes to address?
Well, we're trying to determine what the gaps are. There is a certain amount of provision, and there are areas, of course, where perhaps we could do more. So what this committee is assessing at this stage is exactly that. What we're doing right, what we could improve within the current resources. There may be a need for more communication, more coordination between all the different players, and see where the gaps are. We can improve. I think mental health issues are more in the forefront now. There may be more issues, or maybe we are more aware of the issues and more willing to recognize them now, whereas perhaps in case, for example, of self-harming in young people and so on, perhaps in the past it was hidden. Now it isn't hidden. We want to address it and deal with it. So there's more awareness. There has to be even more awareness. I'm sure we can do things better, and this is what this committee hopes to determine.